And based on your findings, what were the top structural barriers that interfered with recruitment? Things like transportation,
Hmm.
insurance, childcare, or clinic workflow. Can you give just a few examples on?
Sure.
Yeah.
Yeah. So there was we contacted hundreds of women, and so some of the barriers were individuals' own health status, as you can imagine. It's a metastatic cancer population, so some just were not physically well enough to participate in research. Others felt like the transportation issue that you mentioned were either their own transportation, or many of them may have had caregiving responsibilities or needing caregivers. So for those who needed caregivers, they didn't want to participate in research because they felt that was an added burden on their caregiver. And for those who were still, even despite their cancer diagnosis and status, were providing caregiving responsibility of family. And so research participation became challenging. Um, in addition to those who were just working and trying to fit in all of the life responsibilities of work, childcare, relationships, research just was an additional uh, burden for a life that was already challenging for individuals who may be experiencing housing instability, multi generational housing, um, income instability. And so even though we had what we thought was a handsome incentive, that incentive still wasn't enough to overcome the challenges for the effort
Mm,
of participating in the access study.
mm. How did geography, maybe urban versus rural,
Mm.
and health system fragmentation influence your ability to reach eligible women?
Sure. So we didn't necessarily have a challenge reaching eligible women because we were using the our community partners electronic health record. But what was a challenge was, once again, the additional time for participating in research. So I'll give you an example. If a woman was going to participate in an interview who lived in a rural part of the Mississippi Delta region, that was sometimes an extra hour and a half drive to come to the university if she didn't feel comfortable with a researcher coming to her home.
Are there any recruitment strategies that clearly worked better, either in absolute numbers or in bringing women who are typically underrepresented in research together?
Absolutely. So, number one, I can't stress the importance of a race and gender concordant research staff. That was an intentional design from the COPI and and it proved it worked. So what that means in real time is that there was never an opportunity for a research participant to talk to a woman that wasn't Black from beginning to end. The recruitment staff, the researchers, the co-PI they spoke with. So there was always race and gender concordance. I think that alleviated many of the concerns that some participants may have had about, am I going to be seen and heard? Am I going to be treated with respect during this research process? I think another benefit was using the electronic health record of our research, our clinical partner. We were able then to reduce the burden of additional screening because we already were able to kind of mine that data. And lastly, using try and true community based recruitment methods. That is just pounding the pavement. There is no way to reach folks who are usually not in research without going where they are. Individuals don't have to participate in research. Individuals sometimes are skeptical of research. And so, if researchers and clinicians, when we talk about clinical trials, don't go where people are, that means libraries, that means churches. That's what we did. That means community centers, using community based organizations, to hairdressers, all of the places that Black women frequent. You have to do that to recruit them. Being passive and hoping that folks will come to you will not yield what it needs to.
Mm. For oncologists and primary care clinicians listening, what are
Yeah.
two, three concrete changes that they could make in their clinic workflow or communication to better identify and engage Black women who may be eligible for trials or observational studies?
Ask them. Esther, I can't make that any clearer. Ask. So many women I talk to in this research and others have said, no one's ever asked me about research. I've actually been interested in research, but no one ever mentioned it to me. And so I don't know where this gap is, where clinicians may assume that minoritized patients are not interested. They may assume that even your patients who do experience social determinants of health are not able to participate. So they may preemptively exclude them based on those assumptions. So the the number one and number two suggestion is literally ask, and then also using social supports. Right, if there is a patient who usually brings in a relative or a friend, a child, engaging that person as well. You engage in the social supports to answer those questions about what would research participation look like is also important.